Hey everyone, I'm Dr. Cindy, and today I want to talk about gastroesophageal reflux disease, also known as GERD. This digestive condition occurs when the stomach acid frequently flows back into the esophagus, which is a tube connecting your mouth and your stomach. This backlash can irritate the lining of your esophagus, which can give you a burning sensation in your chest, usually after eating, which might be worse at night. Other common symptoms of people who experience with GERD are regurgitation, coughing, chest pain, and they might feel that there's just always food stuck in their throat. You may be wondering, what causes GERD? Well, the most common risk factors are obesity, having a hiatus hernia, and being pregnant. But then, of course, it shouldn't surprise you though that poor diet, smoking, stress, excessive caffeine intake, and certain drugs can all contribute to GERD as well. However, did you know that recent studies suggest that having a decreased lumbar lordosis, which is the curve in your low back, combined with back muscle weakness, can have a significant effect on the presence of the disease. Also, having an increased thoracic, which is mid-back curvature, which is we call hyperkyphosis, so hunchback, it has also been found to cause and to contribute to the signs and symptoms of GERD. So there are at least two mechanisms whereby altered spinal and postural alignment can lead to GERD. So the first is a direct mechanical effect. Loss of lumbar lordosis and thoracic hyperkyphosis will increase the pressure placed on the stomach and the esophageal system. And in some cases, the pressure is so severe, it will cause a displacement of the stomach downward, leading to a condition known as hiatal hernia. Furthermore, the altered spinal postural alignment will cause inhibition of the stomach gastric muscle reflex activity that's really critically important for digestion and transportation of food from the stomach to the intestines. So in the end, this complex reaction caused by altered spinal alignment is what leads to GERD in many cases. The second is a direct and indirect neurological effect. So further compounding the mechanical causation of GERD is the fact that slight, moderate, and severe spinal abnormalities and misalignments in the spine will put unnecessary and often detrimental amounts of pressure on the delicate nerves coming out of the spine. So since the nervous system is responsible for every function of the human body, including movement of our limbs and functions of our vital organs, it should be apparent that altered and inhibited nerve activity as a result of poor posture can also lead to disturbances of stomach function as well. So as a chiropractors, we call this altered nerve function from an altered spinal alignment nerve interference. Nerve interference can diminish the amount of vital nerve energy reaching the organs, including the stomach. So if left untreated, the stomach and digestive tract will go into a state of dysfunction and eventually disease. Many GERD sufferers, under the care of corrective chiropractic care, have reported significant reduction in their symptoms though. And so that's because realigning the spine back to its healthy shape and strengthening the back muscles reduces the mechanical pressure on the internal organs, in this case the stomach, and allows nerve energy to flow freely throughout the body, and therefore restoring normal function to the stomach and other vital organs. If you have any questions about GERD, don't hesitate to pop it down in the comments below.